Welcome to the Brain Trust, a physician's guide to diagnosing Alzheimer's disease and related dementias, brought to you from the Illinois Academy of Family Physicians. I'm Dr. Kate Rowland, family physician, member of the IAFP, and faculty at Rush University. Funding for this podcast series was provided by a grant from the Illinois Department of Public Health. The goal of the Brain Trust and this podcast series is to educate and empower the primary care clinician in the early detection, diagnosis, and management of Alzheimer's disease and related dementias. Clinical resources, free CME, and other educational materials are available online at thebraintrustproject.com. CME credit is available for each podcast. The Illinois Academy of Family Physicians is accredited by the Accreditation Council of Continuing Medical Education to provide continuing medical education for physicians. Information on how to receive credit can be found on the Brain Trust Project website. Thank you for joining us as we empower each other and provide training on the early detection of Alzheimer's disease and related dementias. And now, today's episode.
Welcome, everybody, to our next podcast in our series, The Brain Trust, about ADRD, the early detection of Alzheimer's disease and related dementias. Today, we continue with our mini-series talking with caregivers of persons that are living or have lived with dementia and to getting their perspective so that they can help guide us as far as how they've viewed that early diagnosis and detection with primary care providers. And so our learning objectives today are just to be able to understand from the care partner's perspective, what are some of their challenges in seeking a primary care evaluation, and then maybe one desire that the care partners express as far as improving early diagnosis and detection in primary care. So again, today, I'm joined by a friend and colleague, Susan Frick, who's a social worker at the Alzheimer's Disease Center with me. And I, Raj Shah, I'm a professor in family and preventive medicine at the Rush Alzheimer's Disease Center. We're kind of like doing a big U-turn because, I came from Naperville today morning and I picked up Susan and we're heading now back west to visit our caregiver who lives in Kane County, in the rural part of Kane County, on a farm by the name of Donna. And we're just on 88, a little bit past Naperville now and getting closer towards Route 30, where we'll take the exit and head into Big Rock. But Susan, while I have you in the car as we're getting closer, can you just tell us a little bit about how you got to know Donna, the caregiver we'll be talking about today, and just a little bit about that story?
Sure. Thanks, Dr. Shah. Donna and her husband, Scott, I met because they both started coming to the support group Without Warning that we run through the Rush Alzheimer's Disease Center. And Scott was diagnosed with young-onset Alzheimer's disease in about 2014. And they started coming and continued very active within our group until Scott passed away a couple years ago. And they were even involved in telling their story for the documentary that we created. So they'd been very involved in talking about what it was like to have Alzheimer's in regards to Scott, and for Donna, what it was like to be a caregiver.
Yeah, oh my gosh, I think we're getting close because I'm seeing a lot of sheep around me right now. They're kind of mixing in with the snow, and it's a little bit hard to tell them apart sometimes. But here we go. By the way, how big is this town, Big Rock? Do we have any idea?
We'll have to ask Donna for sure. It's not huge, but it was fun filming here with the sheep and with them.
Yeah. And now we're here at the front door. And thank you, Donna, for having us over here today. Really appreciate it. I was asking Susan, and we didn't really know as we get started. Tell us a little bit about Big Rock. It's my first time here. And how big is the town?
We're only 1,500 people. So it's close enough to Chicago, but still have that sense of rural. Yeah, it's been a really nice place to live.
Wow. And tell me just a little bit before we get started, just about how did you end up in Big Rock? Did you always grow up here or?
No, in fact, we weren't farmers. We're corporate types. Scott had worked for M&M Mars, and in 2000, he was suddenly discharged. And the reason I put that in perspective, it gave us a chance to kind of retool and rethink careers and move out and start farming. But in hindsight, that's about when his symptoms started with the Alzheimer. Because couldn't remember meetings and things like that even back then. But the blessing was we got a chance to be farmers.
It's a great story. And then, I'll let Susan kind of start by just kind of getting a sense as you were telling us a little bit about what you started noticing. But Susan, if you want to just kind of lead us to that.
Sure. Yeah. And Donna, when you first, and it sounds like there was a period of time there where maybe even now looking back, you realize Scott was having some issues. But when you started to look at having him seen by his primary care physician, What were you noticing and how did that process go for him and for you?
Well, initially, like I mentioned, we started farming, so we got busy in that lifestyle, but he was showing a lot of irritability and frustration with himself. So he went in for sleep apnea tests at first. And then a few years later, that sort of panned out okay. Then they thought maybe it was midlife crisis because he continued with the frustration and anger. And then it really came to a head in 2014. We went to his primary and he was in tears actually at the appointment. I went with him and he just said he didn't feel right and couldn't remember things and was frustrated with himself. And the doctor looked and said, well, we've done all these tests. And I said, could it be Alzheimer's? And he looked straight at me, the primary care doctor, and said, no, it couldn't be because he's way too young. And I said, ironically enough, his aunt was diagnosed at 45. Hadn't thought about it till the minute of this appointment that I felt like I had to share that with you. And I never made that connection, seeing him starting to be frustrated and forgetful until the appointment. And I asked the doctor, please, could we consider that? He did follow up and give me your name, Susan, also a neurosurgeon at Edwards. And I called, that's how I got a hold of Rush first. I called Susan first to see, what could I do? What kind of test or who could I see? And I remember saying that it was too long. The wait list was so long. So that's why we went to the neurologist at Edwards.
So did you purposely go along with Scott because he was going to be bringing up the issues of memory problems?
I wanted to represent what my perspective was.
Sure.
Scott was still in denial. I don't think he would have given a total picture of a lot of the issues, that I was able to. And I have to give credit to the primary. He did listen to my perspective.
And about how old was Scott at that time when you went in to see the primary?
He was 54.
54. And then how old was he when you said you thought he might have, when you retired and you first started farming and maybe started noticing symptoms?
44.
44. So about 10 years or so, you were noticing some changes going on. And
starting that, we did try and follow up with the diagnoses like the sleep apnea. And this was the same doctor. So he had seen the progression over the 10 years and did hear me voice concern throughout that long process. But it was only until I insisted, let's consider the Alzheimer's, did we start the ball rolling to get him tested.
And was that really, if I can kind of just clarify in my mind about what made you insist at that moment? Was it the history of his aunt that you remembered and recalled, and that's what made you say, but Scott may not have told you that his aunt had this?
No, Scott had told me. In fact, it was the day we were getting married, she was diagnosed.
Oh.
Walking down the aisle and thinking till Alzheimer's do us part.
Oh, wow.
Thank goodness.
I had back then, yeah. But, I put it in the back burner because I didn't really want to focus on it. And, we were married 34 years. But it was at that appointment almost in desperation because I know we'd gone down all the blood work and medical and, sleep apnea and midlife crisis issues. And I was at wit's end because I could just see him starting to deteriorate. He's tried to take like part-time jobs, even though we were farming, we weren't making it financially. So he kept getting fired. For his inability to remember to punch in or do the job or remember anything online. And that attributed even more to the frustration.
Sure. So when the doctor said to you, oh, he's way too young, it couldn't possibly be Alzheimer's, how did you two leave from that appointment? What did it feel like?
I was just forlorn, because I said, now what? Where do I go? And then I got a call from his office with your name. So again, he did listen. That he did pursue, possibilities of, who could I go to after that? And then the next.
So in some ways there, I just want to kind of clarify. So you brought up the issue with the clinician. Could this be Alzheimer's because of the family history? And it was mainly that you were, at that point, the primary doctor gave some resources to look for things, but was there an evaluation the primary doctor did for the memory concerns at that moment? Like just check where he was at with like a short test, like we call the mini mental state exam or the MOCA exam, anything like that?
No. But then when he recommended, I couldn't get into Rush. That would have been my preference, but it was going to be a long wait. Then when we went to the Edwards neurosurgeon, she did that test. And she did not listen to anything that I had in terms of observations. And so I know it's not the primary, but it does show another example in the cog of what somebody shouldn't do at an appointment. She looked straight at Scott and said, "Oh, he has it bad. He has it really bad," after he did his test. And Scott squeezed my hand so hard and started crying because he was cognizant enough to know that she was saying he's got it bad, And so she did refer me to the neuropsychiatrist. I think I actually just found his report the other day. It was in some billing files, and it was really sobering because to reread, Scott's commentary of how he knew he was deteriorating. It was touching. Neuropsychologist.
Mm-hmm.
He was really a gentle giant. He took us both on and did listen. So even though I had a bit of a rough, appointment at the neurologist, Dr. Whirligitz was very gentle.
And this is a kind of a common story we sometimes hear, right? Like it takes a while for the family to recognize something might be going on. It takes a while for the primary physicians to rule out other things that could be happening, especially in somebody younger, like sleep apnea or some other features. And then it finally comes to some moment where things start moving, in a direction. And then you have to go to, the primary doctor has to coordinate with another provider that, like the neurologist. And then maybe the neurologist will also ask for, neuropsychological testing. So did you feel like all those connections were being made, or were you having to really advocate to make every connection move forward for your husband?
The connections were made, but what was missing, and thank heavens for Susan's group and for Rush, there was no follow-up with, now what do you do? I was given the diagnosis and it was like, yep, end of discussion. I never saw any of the other doctors. His primary never called us again. And so unless I had found Susan, I would have been just at a total loss.
So can I confirm something there? So as you said, primary never called us again, but was it for that issue of the memory? Was Scott still seeing him for other health conditions afterwards, or?
He didn't have any other health conditions. He'd been really hospitalized. So no, there wasn't a need to really see him. So, it was just a total loss. I mean, financially, he had been fired. So we had no health care. So that was one motivation of not just going in for well checks and whatever, because we didn't have any health care. My health was also deteriorating. And so I had no health care. And so we had to wait till he was finally, I did all my applications. Thank heavens I'm not, scared of doing filing, but I filed for his disability and then waited 2 years for Medicare. So we were without any kind of financial support.
And learning to do some of those things that came through the Without Warning group and kind of listening to other families.
And was the next step. So it was very beneficial. It was the way I got through all this and continue to get through. I still sit through meetings, even though I'm a widow, but it's an extended family. I mean, it's better than family. My family didn't even get it as well as somebody that's actually going through it.
Right. And do you think being in a rural area, do you think it was harder to find people who understood what was going on?
I have a good example. Rural America, it's a nice place to live, but it is conservative in terms of a lot of philosophies of life. And Scott was in the driveway when a neighbor pulled up and said, "Did you hear such and such wife? She's acting like she's got Alzheimer's, but she's just being lazy. She doesn't want to do her housework and she just doesn't want to, contribute to the family." And Scott squeezed my hand again. That was his little symbol. And he goes, "You know what? It is actually a national disaster or it's a happening. It is real." He didn't realize he had it. And he was still coherent. He was a very articulate gentleman. And he was like, they need to listen to her and get some help because it's real, so, and pretty much people saw him as being healthy and they kind of thought I was making it up and trying to make excuses. So no. And my church community, he was, very involved, played guitar, just totally abandoned us once we came home. But he didn't go over to check. So we didn't have a church support. We didn't have community support. it's kind of like you felt like you were a leper, when they found you. And I think the thing is with the younger onset, you got the golden nest egg and the idea you'll retire. And we were that reminder that maybe that isn't life. That may not be the way you head toward life. So I use it as an opportunity when I tell our story to say, front load life. Remember, life isn't always guaranteed. You need to front load it and enjoy each moment as you can.
Right. And it sounds like from your first few appointments, if you hadn't gotten connected to the group and be a part of the support group, that having that emotional resources was really important for you and for Scott too, I know. Like, do you feel like...
If I hadn't found you, because I wouldn't know where to turn. There was no recommendations of a social worker or financial consultant or anything. We were just pretty high and dry. The way we actually made life work was my dad had died at the same time Scott was diagnosed, and my mom had Alzheimer's. So we moved her in. So I was the major caregiver for both the early onset and the senior Alzheimer's patient for 8 years. And, she helped us get through that time financially until Medicare could kick in. But I don't know. I would have just not known where to turn if I hadn't heard about the group. So yeah, that would be my one recommendation, that, once it's diagnosed, that there's a follow-up with the caregiver and family, to provide recommendations for social services or, how to cope.
We've been talking about, it's not only just the person who's living with the Alzheimer's disease or related dementia that needs support and medical care and coordination that, has to happen sometimes in a primary care or family medicine setting. But it's really about the caregiver too. And, the informal caregivers, as there's more family members or others that are involved, they all sort of need, to also maintain their health and well-being and support. And I'm just curious, in your case, did you have a primary care physician? Did you talk with them about being a caregiver? Did you get any support for that role that you played?
Well, I didn't have the financial ability to go see a doctor. I had no medical coverage. So no. Informally, I had a chiropractic that was also a friend. And so she did kind of just support me as a friend, but not as a medical professional until I could get coverage. Yeah. And I have to get on my platform for a minute. I actually also feel how important it is to follow up with the caregiver even after the patient has died. And I don't see that too often. I've been volunteering, caring across generations. I was a fellow for them. And a lot of different universities want to talk to people as they're caregiving, but not after the fact. When a person dies, what do we still have to go through? My case, I broke my back in the process of caregiving and trying to get back. I can't walk unassisted, and trying to get myself back in order. And Arizona State recently called and I interviewed, and that's the first study I've ever seen them focus on what happened after your loved one died.
Yeah, that's a really important point to bring up, and a nice, important message for our audience to hear about sort of the continuity. We think some of these are like transitional roles, but they do have lasting meaning and a need for continued care and support. So thank you for bringing that message up. And then as far as, you mentioned a few things that you would have maybe, wished a little bit more with some of that follow-up care and support as you were going through it with the primary care team. Is there anything else you would have hoped to be slightly different, or you would want, for other individuals living in small towns and communities in rural Illinois and other places? What would you, based on your experience, what would you kind of want, as far as, from a primary care clinic and physician and team engagement to help in this early diagnosis phase?
I know it's a little bit early to have the primary mention about hospice, but thanks to my friend who also was a doctor, she said about consider hospice earlier rather than later. And so that was something stuck in my head. And Scott actually started having seizures. He had childhood seizures, and so his seizures kicked in sooner with his Alzheimer's. And he got on hospice for over 3 years. He had good care, physical care, physician through hospice. And I got my support through them as well. of having people come in. But I always thought it was only 6 months before somebody died. So it would be helpful in a gentle way. I know your first diagnosis isn't the moment you'd say and consider hospice, but the continuity of calling up and checking on the family. And as you knew, the timing got closer to mention, consider hospice would be valuable too.
Yeah, and in many primary care practices now, there are teams, right? Like the doctor's there, but there's usually nurses or there's front desk staff or others that you interact with as a caregiver or somebody with ADRD and who they have to interact with. How did you get that sense of that connection in that office? Was there, sometimes maybe the doctor may make the diagnosis and be involved in sort of the ideas, but sometimes the other team members may be involved in like looking up resources or knowing what's in the community. Did you get a sense that there was sort of a team understanding in the primary care clinic that you interacted with?
No, the primary care team, there was not a team at all. And maybe things have changed because there's been quite a few years now, but there wasn't any mention on, and these other people could give you, it's just 2 names. I was handed Susan's name and the neurologist's name, and that was it.
Yeah, I'm really kind of curious at some point to know how he got Susan's name, and unless he had some experience or somebody had mentioned it, but it was just interesting that's somehow it connected, right? But just how it happened. Yeah,
right. Unless he went and looked something up, considering he had just told you young onset didn't happen as much.
It must have really bothered him enough to research it and find out. Maybe he Googled,
Yeah, and I give him credit for tracking down additional resources for you and getting back to you.
Yeah, and that's, it's such an important way we learn too, I think, in primary care is we have to hear what's in front of us and what our patients are experiencing and their caregivers. And then sometimes it is like a well-established primary care doctor starts learning, well, there's always going to be things I don't know or can't keep up with, but I've got to be humble enough to recognize that and then get, but still connect people, right? Like still figure it out. So I think that's how we always learn, is just being part of those stories in people's lives and then understanding like how we can maybe further it a little bit along and we learn in the process. So, definitely a really important story to share of, your experience and the engagements there. Are we missing anything in our conversation today that you would like to let, primary care physicians in training and currently practicing in Illinois know about that we haven't touched base yet?
Yeah, I think a follow-up, to reinforce that it's important. Even after the fact, there's another gal in my support group that lost her husband, and his neurologist calls to see how she is, even though he's passed. And he's no longer on the billing cycle, but that particular doctor cared enough to see how she's doing now that he's gone. And so something along the lines, when it does affect a whole family, and a little bit of that would go a long way. A little bit.
No, it's a really important message. So, well, honestly, we really thank you for taking time out of your busy schedule to spend some time with Susan and me visiting Big Rock and your farm and talking with you about your experiences. I think our audience will really find a lot of value in this. So, Susan, did you have anything else before?
No, just thank you, Donna. You've been such an advocate for sharing your story. And I think it's important because we don't always hear from people who, were struggling with insurance or in a rural area and maybe the resources weren't as easy. So I think there's probably quite a few people who are going to benefit from hearing this.
Thank you for having me.
Yeah, thanks again, and hope things go well with the sheep farm as we head out. So again, to our audience, we really appreciate you listening in to our podcast today with a really engaging conversation we've had, and we look forward to being with you with another podcast in this mini series of talking with caregivers from different backgrounds about their experiences. So until next time, thank you again, and we look forward to seeing you in the near future.
Thank you to our expert faculty and to you, our listeners, for tuning into this episode. If you have any comments, questions, or ideas for future topics, please contact us at podcast@thebraintrust.com. For more episodes of The Brain Trust, please visit our website, thebraintrustproject.com. You'll find transcripts, speaker disclosures, instructions to claim CME credit, and other Alzheimer's resources as well. Subscribe to this podcast series on Healthcare Now Radio, Spotify, Apple, Google Play, or any major podcast platform. Thank you again, and we hope you tune into the next episode of The Brain Trust.